Hi, my name is Yasu from Japan, and in my video I do hitorigoto, which means talking to myself. And then currently I am suffering or battling my male menopause, which is andropause. Basically, my testosterone level is way too low, and I've been suffering from a lot of symptoms like the depressions, low energy, and not much sexual desire, and so on. And I'm getting the treatment. And then what's happening right now here is that the supply of testosterone injection in Japan has been super low, and then the supply has been limited. That's why the it's getting harder and harder for me to get the testosterone injection regularly, which is very worrisome. So I just want to share these informations. And if you happen to live in Japan and then you feel that you might suffer from male menopause and then andropause, or maybe you're actually doing the treatment right now, you should contact your doctors to make sure that you can continue to get the injections and then treatment. There are other options according to my doctors, but the insurance doesn't cover those the other options. So I'm really hoping that I can continue to get the testosterone injections. So what's happening in this country is that a lot of medications, there is issue with supplies. I don't know exactly what is going on because I asked my doctors why this is happening, and then my doctors are like, this happens regularly. Some companies stop producing, and then some companies, pharmaceutical companies, getting harder. Oh, it's difficult for them to get right ingredients, the chemical substance, and everything to synthesize certain medications. And then starting from June this year, this situation is really happening to the supply of testosterone injections. So every time I go to my doctors, they're like really giving me warning that we need to kind of consider how often you get injections because you might not be able to get the injections as regularly you used to be able to do. And I asked my doctors that does that affect my treatment? Basically, like the if I have to reduce the number of the injections, what's gonna happen to the outcome of this treatment? Uh, does that mean that it's gonna kind of delay when I'm gonna get better, or is this gonna reduce the possibility of me getting actually better? They say that it might not affect that much. If it becomes serious, then we can really explore other options. But I don't think they want to do it. First of all, other options insurance doesn't cover, so I need to actually pay more money. And then those are not the main options that they offer. So they really want to stick with the testosterone replacement testosterone replacement therapy by injections. But nonetheless, I might need to change it from the injections to a cream, which I'm not sure if that's effective or not because I've been doing a lot of research for this male menopause symptoms and treatments in Japan, but most of them are really focusing on the injections. They are not really explain or like the review on the effectiveness of the cream and other stuff because first of all, as I said, that insurance doesn't cover, so the patients really don't go for the options, and then if patients don't use the options, then there wouldn't be much review on the effectiveness. So what I want to say is that I'm really worried about whether I can really continue to treat my male menopause and everything because every time I get injections from the next day I feel really energetic and everything, and I've seen so much improvements in my conditions and I really want to keep that. because I really want to don't go back to how I was a month or 2 months ago, because that's really, really horrible. And then if you are suffering from the same situations, or like suffering from male menopause in Japan, or like you don't feel well and then you feel like you should check it out, you check your body in terms of your testosterone level and everything, just go to your doctor and then get your blood tested first. Even though they might say that, oh, we don't have the testosterone injection right now because of the limited number of the supplies, but you should check it regardless, because the first step is to find out what is going on with your body. And then hopefully a company, they said that they start increasing the number of the supply for the testosterone injections in Japan, but it really takes time to start providing the sufficient amount of the injections to the entire market in Japan. But get your test and then be ready and hoping that the supply is going to be stabilized. And then if you're actually getting the treatment right now, I think you should call your doctors and then make sure that next time that you're gonna go to see your doctors to get the injections, they can actually reserve the injection for you. Because some clinics, the hospitals, they reserve what's left in their hospitals for their current patients, because in terms of the injections, people need to get it regularly, otherwise it doesn't stabilize the level of testosterone in their bodies. And in my case, I was just studying, and then my hospital, they don't really say that much, and they don't really say that they really prioritize those patients who are getting the treatment for longer. But I'm getting this sense that because I'm just new to this treatment, so they might kind of don't put priority on me. I'm not sure, but I'm just hoping that I can continue to get the testosterone injections. But the market and the supply is very unstable, so I just want to share these informations. But regardless, don't feel so much stressed out in your life. Do something that activities and everything to release your stress, and then sleep a lot and live healthy, because staying healthy is the most important things. Once you have some issues with your health, then you really have to go through a lot of procedures to hoping to get better. But if you are still suffering and battling, it's gonna affect everything. Like, it's really affecting me everything. So I guess you're watching this video because you want to get some information about the treatment for the male menopause, but I'm really hoping that you don't have to go through the treatment. So please stay healthy. So please take care, and then じゃあね、バイバイ。